Hi, and welcome to Module 4. If there's one thing that I have treated a lot of, and maybe you have as well, that's pain. As a licensed acupuncturist and doctor of Chinese medicine, most people think that that's all we treat, but au contraire, we treat so much more. However, we do in fact treat pain very effectively. Acupuncture, Chinese medicine, herbs, and the liniments and the different modalities that we were taught in Chinese medical school are so effective in natural pain relief. And so I'm excited to share with you this module on joint health, sports nutrition, and neurology. It reminds me way back when we had the most delightful receptionist, and she was bubbly and cheerful, and patients loved her. But all the patients weren't so nice. And sometimes they would come in angry or in a bad mood. Can you relate to this? And she would say to them with a big cheerful smile, "Oh, hun, when you're in pain, you don't have to be one." And then everybody would laugh most of the time and kind of get him out of that grumpiness. Ever since I witnessed her doing that and seeing how she would soften the patients and get them to turn around without making them feel bad, I've been using the same thing. So if we're in pain or we have patients that are in pain, we can just kind of remind them that when you're in pain, you don't have to be one. But let's dive in, get your hand out, or just follow along as always. Specifically, here is at a glance what I would like to cover in this module. Common conditions when we talk about pain, over generalized kind of pain. So what are your go-tos? What's in your toolbox when somebody comes to you with pain, or when you have pain? What do you turn to? Is it ice? We'll talk about that. Arthritis, muscle cramps, muscle pains, and all the like. Then I'd like to move into sports nutrition, protein sources, the pros and cons of those. Maybe there's some vegetarian options, vegan options. Amino acids, I have it bolded because amino acids are building blocks of our bodies. They're so important to the proper functioning of our bodies that we could spend a whole module on just amino acids, if not a whole 10-week course on them. But I'd like to touch on the importance and some of the important ones for different conditions. And then I'll finish the sports nutrition section of this module discussing sports recovery strategies. Finally, we'll finish this module up with neurology, specifically headaches, migraines, and that sort of condition that most of us have treated as well and probably go under pain. And so many of the remedies and solutions and strategies that we'll discuss for pain can help with headaches, but let's talk headache specific at the end as we wrap up this module. All right, joint pain, causes, supplements, herbs, lifestyle, drugs, warning signs. If you are looking at one of the handouts that I gave you for pain, you'll notice under causes, it's empty, it's blank. What? Does that mean there's no cause of pain? Oh my goodness. There's so many causes of pain, and it can be complicated, it could be simple, it could be injury, it could be insidious, meaning we don't know how it started. It could be overuse syndrome. There's just so many causes of pain, but I want to say probably 100% of people will experience pain. And as a practitioner, you'll probably treat it in some fashion. So let's look at my naughty and nice visuals that I have. Guess what? There's no naughty, because we kind of know what the naughty things are because they result in pain. Our bodies are so great. Our body is like a car. It has gauges, and the gauges are pain when you are running it wrong. So listen to your body. I always tell people that. Be careful, be mindful. Your pain is your body talking to you. So here are some nice things we can do for pain in visual. Massage is great for circulation and removing any built up lactic acid in the muscle. So massage is great. Highly recommend it. And as a self-care strategy, when was the last time you got a massage? Maybe you are a massage therapist and you're like the cobbler whose kids have no shoes. Well, put some shoes on your feet and walk your talk. Massage is fabulous. I'm listening to this lecture with you because I'm really guilty of it. Every time I get a massage, what do you think is the first thing I say to myself, sometimes out loud? Why do I wait so long to get another massage? So, massage. Our friend, the pineapple, has a special compound, bromelain, and it's found in the core. So you could take a bromelain supplement or eat the core of a pineapple. I prefer the pineapple itself, blend it up, maybe a Mai Tai, that'll help with your joint pain. But the idea is it reduces inflammation specifically in tissues and then will help reduce pain in the body. Now, you're also seeing one of my major go-tos when it comes to natural pain relief, and that's Traumeel. I love it. It's a homeopathic topical remedy. You can also take it orally as a homeopathic. Traumeel is so great for pain after or even prevention. So you can take homeopathic Traumeel before surgery or before a big workout, or we used to do a lot of Traumeel when I did racing. I used to do adventure racing back in the adventure racing days. And then you see on the nice list as a visual, meditation. Yoga can be helpful. Again, just being mindful of pain. Don't overstretch. If you're stretching and you're starting to feel pain, I always tell people back off, stretch a little bit, get a little bit into the pain zone, then pull out. The idea is if we overstretch a tendon or a ligament, it's like a rubber band. I want you to think about this. If I take a rubber band and I put a tiny little tear in it and I pull it, it's going to rip all the way down. Oh, we don't want to do that. So if we've injured ourselves, I don't really recommend going out and stretching it if we suspect there might be a tear. How will I know if there's a tear? There might be bruising. So if there's bruising, there most likely was some sort of fascial tear or injury. Absolutely be mindful of stretching because like that rubber band, you don't want it to snap all the way down. Rather, what we want it to do is to knit itself back together. Let it heal. Use the Traumeel. Use some meditation. Relax. Get some massage to get circulation into your body and heal that area. Allow the tissue to heal itself. Get some, eat some pineapple, take some bromelain supplements to reduce the inflammation so the body can heal itself.